Dr. V. Ramankutti from Kerala. Dr. Ramankutti is a researcher and trainer in public health, epidemiology, and data science. His work has focused on the interface of health with the dilemmas of socio-economic development in Kerala. He is also interested in the ethical implications of public health policy. In his spare time, he loves to paint. With this very brief introduction, I now welcome Dr. V. Ramankutti to make his presentation. Dr. V. Raman.
First of all, let me say that I'm very happy to have this opportunity and thank the organizers, the museum, my friend Dr. Ajit Kumar, Dr. Radish, and I'm especially happy to see all of you. I think most of you, if not all of you, are younger than me, which is a very good thing. I mean, to be invited here is a privilege. So I'm happy to have this occasion. I belong to the 1981 batch of Trivandrum Medical College. Pretty senior, all of us. I think we have retired from official service, if not most. And I was the head of the Achyuta Center of Health Science Studies in Trivandrum, attached to Sri Chitra Tirunal Institute. Currently, I do have an appointment at the Amla Cancer Research Center, Thrissur, as a research director, but I am unable to go there. Like, unlike most of you, I am unable to work. I am confined to my house in Trivandrum. So now, briefly coming to this theme of pandemic and how it's going to end, the end game. As an epidemiologist, I suppose I should be able to tell something about it, but strangely, I find that I really don't know what's happening, because this particular disease is very strange in the sense that I don't think it follows any pattern that we have seen so far. So it's very difficult to make reasonable and intelligent prediction how this is going to end. So I don't mind admitting that so far it has eluded all predictions and seems to have a mind of its own. This is not unusual, because I remember in the first ever pandemic which I have seen in my professional life, which was the HIV/AIDS pandemic, there were all sorts of wild predictions, some of them based on a lot of statistical, mathematical calculations, all of which I would say that went wrong, because pandemics do seem to have a mind of their own, and I don't think this is going to be any different. So, but even then, predictions are useful, because predictions remind us that to be prepared and to see what could be the worst case. In that sense, I wouldn't say that predictions are bad. So if you look at this disease, there is no country which has escaped its clutches, and which points to the fact that there are no natural protections available, either by race or gender or socioeconomic status or even climatic conditions. Even though several theories have been proposed, I think they're all wrong. So whole of humankind is affected, and different systems have attempted to contain it, even different health systems, some of them very controlling kind of systems, as we have seen in China and some of those countries where they have literally shut down everything. And there are other examples where people have been left pretty much to their own devices, like in Sweden. And of course, results are varied, but if you look at the variability, it is not much. If you look at overall what really something has been very effective or not very ineffective, you see that that is not seen. Everything seems to have some kind of, not particularly effective. No strategy has so far been particularly effective, though some control has been achieved in some places at some times. But so I don't know whether all these doomsday predictions will come true. Even in Kerala, it was predicted that we will have lakhs of cases by April and May, but it did not turn out to be true. And at one point, we thought that we had almost controlled the epidemic, and we had practically no cases in the state, which was a particularly grand achievement for a small state, and I think it speaks volumes about our health system and its preparedness, and I think we should all be grateful for that. But that status did not last long. We could not be isolated from the rest of the world, so we are back to fighting the epidemic in its full fury. So this question is, how do I see the pandemic ending? Now, in the epidemiological sense, if you look at all these models like the SIR model, the susceptible infected or and recovered, or the susceptible exposed infected and recovered model and all that, ultimately the curve does come down. So it is a kind of prediction which you can make generally, that it has to come down, and it comes down not because everybody becomes resistant or immune, but because the momentum of transmission dies out. Because when you don't have too many people to infect in the immediate surrounding, then it has to die out. So that is what happens in all these models. And so we will reach a point, but the point is, or the question is, when will we reach that point? And I think it's very difficult to predict, because apparently by almost all the studies that we have seen, the immunity to this infection is not very effective. Apparently it doesn't last much. But today I've seen some papers or some information saying that it's mostly the T cells which may be more important. So we don't know. So we don't know what is going to happen. And the only other thing seems to be the possibility of the vaccine. And the vaccine, as so far, there are so many groups working on vaccines with kinds of input and various kinds of approaches. And some of them have been rather successful, and they are going fast forward. But even then, I don't think that there are so many impediments, social, political, and other impediments, before a vaccine becomes available to people on a large scale. So it does not just mean that a vaccine which has gone through a clinical trial and it comes to the market, everybody is going to get it. No, the governments have to take a decision of how to, what is the best immunization strategy, and who should get it first, and all those things remain. So it is not going to be some time, at least I don't see it happening before next year. I mean, that is the most optimistic prediction you can see. But even then, whether this will completely die out is another question. And then again, there is this permanent question of, because it is a virus like a flu-like virus, whether this can mutate and produce new kinds of epidemics in its wake, which is also a very important, very real question. So I think it looks to me that we are in for a long haul, at least till next year, maybe even longer. At worst, maybe some few years. And there are things that are absolute no, we are to coexist. That is this question of whether somebody has raised this question of when we are going back to the normal. And I think the previous normal may be very difficult to achieve, and we may have to live with this kind of restrictions on, crowding and the permanent use of masks in public and repeated hand washing on. Some of these things may have to stay with us for a longer time. That is what I do think.
Excuse me, Dr. Ramankutty.
Yeah.
Dr. Ramankutty, I'm just interfering for the interest of time.
Yeah,
just please. Thank you.
So we are entering a phase where contract tracing and isolation, at least in Kerala, we have entered a stage where maybe that may not be very effective now. It is more of a focus on treatment and how to, bring down the numbers of death and other complications that we are seeing. And so that is, so I'm closing with this, that I really cannot predict anything, and that it is all something which left to a lot of other imponderables and variables that we have no control over. Thank you.